Good evening. This is John Bailey, and this is People to be Heard, the program where people who have something to say have their say. Tonight, you've got Dr. Una Hopkins, Administrative Director of the White Plains Hospital Center for Cancer Care in White Plains, New York, USA. It just opened in February. We're going to talk all about what it means for Westchester County and the area. Doctor, thank you for taking time out of your really busy schedule to do this program.
Thank you very much for having me.
Right, thank you. Now, first of all, what was your goal in creating the Cancer Center?
Well, the goal was multifaceted. We wanted to make sure that we had an environment that was okay for patients, for their family members, and everyone else in our community here in White Plains. So Susan Fox, our president and CEO, had a vision, and she tasked us all along the journey of making sure that this was created in a timely fashion to be able to give patient care quickly, easily, nicely accessible.
Mm-hmm. And what does the new center provide as a cancer care facility that other competitors do not?
I think we have an environment of extraordinary professionals that care deeply about their patient population, and I think that they have an expertise, a level of expertise here that matches the environment in which they're practicing.
I see, and from what I understand from the tour that we have already done, that we're going to see later in the show, that is everything is so integrated and coordinated, which is unusual in my opinion in healthcare.
We wanted to make sure that the patient experience was that of the utmost comforting journey they could possibly have. If you have to have cancer, you have to have an expert clinician, physician to guide that care. You have to be a team of many, many professionals to make sure that everything is taken care of. And you need an environment in which to heal. And this environment is a very healing environment. I don't like to say spa-like, but it is spa-like because it's warm with the colors, it's comfortable with the seating, it's beautiful with the art, but it's functional for all the professionals that operate here.
Right, in a non-threatening and not antiseptic at all way.
No.
And that has always been the concept. A hospital always feels like a hospital, and having seen this does not at
Thank you.
all. Now,
thanks, Susan Fox.
Exactly. Usually when cancer is diagnosed, it comes from routine examination through a doctor who refers you to an oncologist, I guess, who is affiliated with a care facility. Right. So how does one pick a cancer facility? Is the patient have to go where the physician practices?
Well, a lot of that has to do with some of their insurance policies and things like that.
Yeah.
But cancer starts at prevention, screening, treatment, and follow-up. So those are really the most important components. And so we have screening right here. We have lots of screening programs for cancer screening. We have lots of prevention programs because you want to stay healthy even after a cancer diagnosis. We have about 19 million cancer survivors in this country, and they sometimes survive 1 and 2 cancers. And so therefore, after surviving the first one, they want to make sure that they are preventing any further. So prevention and screening are 2 key important parts to having a cancer center. Treatment is a very important part. And so here, in this facility, we have access, patient has access to their medical oncologist, their surgical oncologist, and their radiation oncologist, as well as a multidisciplinary team that can help them through their therapy. So the treatment aspect of things can be multifaceted. It doesn't have to be just one.
And you can walk in for cancer screening, right?
Not in this building, but in our cancer program, yes. We have 4 different sites in which you can do, for instance, breast cancer screening. We have an Armonk facility, we have a Nurse Shell facility, we have a Rybrook facility, and we have a hospital facility here.
Yeah, and if you wanted to find out how to make an appointment for that, how do you do that?
You would just dial one of our main numbers and we'd be able to direct you in your geography with your zip code.
Yeah. Now, 3 years ago, there was a task force formed by business and health providers with the aim of not diminishing healthcare options or diminishing existing health facilities around the county. How has that worked out? We have seen Montefiore partner with White Plains, and we have seen various mergers. Westchester Medical Center has taken over some hospitals. And how is this benefiting the patients?
Healthcare is an incredible changing environment right now. There's nothing static in healthcare. There's a lot of hospitals combining with smaller hospitals. There's academic institutions working with community institutions. There's physicians that are working with other physicians that in previous times they were competitors in a market. Now they've come together to look at how they can best care for patients in an expense driven environment, but keeping costs contained and making sure that we get the best care out to those patients with the most efficient and effective mechanisms out there.
I see. So you would call these friendly takeovers the benefit of the patient? All right.
I actually
Putting words
don't.
in your mouth?
I mean, I know the word takeover sounds like it's got a negative connotation, but I honestly
Definitely
have to say,
wrong choice of word by me. I apologize for
but
that.
I think our partnership with Montefiore has been absolutely wonderful. It's allowed us to embark on many things and offer many things to our patient population. For instance, clinical trials. We have access to over 500 clinical trials now through the Montefiore network, and our patient population is able to do that now too. We had some clinical trials here. We run smaller, but now we have access to novel, new ideas. Remember I told you earlier about the immunotherapy. Immunotherapy, there's only 4 drugs that are FDA approved currently right now, but there is numerous numbers in clinical trials. And so by our partnership with Montefiore, it allows us to have more access, and our patient population more access to novel agents.
Accessing cutting-edge research findings first. I
Yep.
see. And has that happened really recently? In the
Yes,
last
we've
few
had a
months?
couple of patients that have been worked through with both our systems. So our clinicians here are experts, our expert medical oncologists. For instance, Dr. Dan Costin and Dr. Sarah Sedan are 2 of our most popular medical oncologists, and they have both worked with medical oncologists from the Montefiore system to make sure that their individual patients were taken care of and got into a clinical trial appropriately.
Yeah. What are the trends in cancer today that you are mindful of?
The trends?
Yes.
Trends in
What?
cancer care are important to integrate patient centricity. You have to have patient centricity, and you have to incorporate integrative medicine. You have to be able to have patients have choices and access to aromatherapy, acupuncture, massage therapy, yoga. Yoga, we have lots of empiric data to suggest that it can help a patient's well-being and quality of life, and pain management. You have to help them through financial toxicities. You have to help them through their bridge and their gap to palliative care and pain management all throughout their care.
Right. Now, what are the fastest growing cancers today? Which should people be mindful of?
Well, we have a lot of cancers that are easily preventable and no one should die from. First and foremost is a breast cancer. Those screening opportunities are there. They're there for everyone. We have lots of grants that even if you're underinsured or uninsured, we have grants that can take care of a screening process. So it's getting the word out and making sure that you're screened early and treated early. Colon cancer, we have an initiative of 80 by 2018, so we've partnered with American Cancer Society to make sure that we have any person that is eligible, 50 or above, to be screened for colon cancer, because no one should die from colon cancer today.
Now, I was reading that esophageal cancer is really growing, and there's no really handle on why it is.
Well, there's a big change in the HPV market, which is it's a virus that we became much more aware of, and that's why teens are now being vaccinated. So again, a prevention and screening is very important against the HPV virus. So, and our smoking population, if you know that the smoking has decreased, our lung cancer has not necessarily increased, but the esophageal and those head and neck cancers. So we've actually incorporated a head and neck specialist here, J.K. Ramsey, who is part of our team now, and we have a whole head and neck team, which is swallowing support, dietary support, the surgical support, the post-surgery support, the radiation and medical oncology that's responsible for that.
Yeah. Now, can we talk about the Affordable Health Care Act as it's presently administered? Is it working for facilities that treat cancer such as yours? Is it more success than failures?
I think the Affordable Care Act has certainly underestimated the amount of people that they needed to be able to care for. I think that in areas like us, for White Plains Hospital Center for Cancer Care, in its partnership with Montefiore, we are starting to see and be able to help a lot more. We're able to access a lot more patients, and they're able to access us. So it's been a very positive influence.
Mm-hmm. Now, let's see, we have a couple more minutes before you take us on a tour of your wonderful facility here. Is there anything specifically you would like to get, a message to get out to the...
Prevention and screening is the most important part of cancer treatment, so that the earlier cancer is caught, the easier it is to treat.
Right. Well, Dr. Una Hopkins, the Administrative Director of the White Plains Hospital Center for Cancer Care, you have been heard. And now, let's go on that tour.
Thank you very much.
Now, Dr. Hopkins is going to be taking us on a tour of the ground floor of the White Plains Hospital Center for Cancer Care. Then why don't you explain to us what we're seeing? This is the entrance to the former Dixteen Pavilion, and
we have the Dixteen Pavilion, and we have the Physicians Pavilion on the left side. They were joined together to be one lobby and create a beautiful space for patients to enter into, so that they can come, they can be greeted by our lovely staff here, beautiful artwork throughout, and then they have an area that they can go in back this way. So I'd love to be able to show you some of the area back here.
let's go and see it.
All right. So we've created a space that is really very nice and very open, airy. We have a little small cafe, healthy choices for patients and their family members, because I think cancer, everybody sort of looks and tries to understand what's best for them, so control is definitely within the food realm. So we have a nice healthy choice cafe and some really great people working with us. The other thing is we started to create a gift shop, and so the gift shop has little knickknacks that really related to helping patients cope through their journey with cancer. So lots of nice little sayings, home is made here with the family that we see, so different things that brighten someone's day each day. Here we created a nice space because sometimes patients come for long infusions and their family members bring them, or other people within their realm, church folks, etc., and they all need a spot to just sort of sit. We wanted to create places where there was plugs. We all plug in all the time. We wanted to make sure that people always had what they needed. But as we move forward now, we're going to turn a corner, and it's kind of a quiet, meditative area, and we've created that space. So this space, again, is for people to just sort of come, sit, relax, have lunch, have a little snack, or just sort of be a little bit at peace with themselves. This journey is a long journey, and it affects not only the patient but their family members as well. So it's not hospital-like because it's not supposed to be that way. We're supposed to be able to create inner energy for patients and help them in whatever it is that they need. So as we enter here, we have another small, quiet area, well lit. Certainly being able to have a patient come and sit, or a family member just sit while their family member's being treated upstairs. As part of some of our regulations in having a Center for Cancer Care, we have to make sure that we have a resource area for patients at all times. So as we enter here, we're going to see this resource area. It's called the Patient Library. And it, again, is another area where you can gather as a group of people. If you needed to have a family meeting, you could do so. We have computers that are available to patients and their family members to be able to look up information. We also do a little bit of teaching sessions here, survivors groups here. We do some intimate work here. Some of the programs that we partner with our community, American Cancer Society, we do Look Good, Feel Better, which helps people put some makeup on and have some wigs if they are, going to lose their hair based on therapy. We have created 2 rooms like this. This one we do personalized yoga, so some patients have different various other aspects of their care that they need help with, and back there is a pictorial of Toyoko, who is our holistic nursing leader here in our institution, and she does a lot of different therapies. So there's some healing touch, there's Reiki, there's a gentle massage, and as well as yoga. Yoga is a meditative state in which you can decrease your heart rate and increase your coping skills, and a general sense of well-being is felt. So this room is identical to the next I show you, and we're going to integrate massage and acupuncture to our program as well. So sometimes the disease allows them or has swelling in different areas, and so massage therapy and acupuncture can decrease some of those swellings and increase a quality of life or a sense of well-being. And so this is the other room that was created. Again, the massage table can fit into the other room, but we like to have two different modalities right now. So single individualized yoga programs for very specific patient needs, as well as meditative states. Well, we are working on getting a schedule together, and we're also going to incorporate our employees, because as you know, we have CEO Gold Standard, which is an award given to employers that really respect cancer prevention, treatment, screening programs, as well as wellness and fortifying wellness for their employees. And so we're going to start to offer those for our employees also. Now we move into a more general area, because sometimes cancer doesn't just infect the patient, but it's family members or other members of the patient's extended family that may need to be treated. So we have genetics. We have two genetic counselors here, and that is, again, right on this first floor. Two very professional genetic counselors, certified, and certainly work within our cancer center. They take referrals from outside physicians from our ACO in our area and other area hospitals. Now, our conference room is utilized by our physicians and our clinicians. So every morning, just about every morning, we have what they call a multidisciplinary cancer conference. And that is putting together the surgical oncologist, the medical oncologist, the radiation oncologist, the social workers, the dietitians, the nurses, and anyone else who may be involved in that patient's care. They come together, they talk about single patients and everything that they are going through. So from whether they'll need surgery, what types of treatments are best for this patient and the patient population, as well as then what other ancillary needs they're going to need. Do they have insurance? Do they not have insurance? Will they need financial counseling? Will they need a social worker? Do they need someone at home to help them when they're getting their chemotherapy? So all of the things, so it's totally multi-centric, and it looks totally multidisciplinary at the individual patient.
Now, Dr. Hopkins, we are here where it all happens. Explain what we're looking at.
So when the patient comes and enters and downstairs through the center, they will be directed to their physician offices, and we have physician offices on 2, 3, and 4, 5, and 6 in this building. This is the second floor. This is Dr. Sedan's practice. Patient would come, they'd register here with the registration team, and they'd be seen back here in the physician offices. If they should need infusion related to their therapy, they'll be transported right across the hallway here to the infusion center. So shall we go and see one of those? And each one of these specific bays was designed with the patient in mind. It's patient-centric. They have control over light, temperature, and sound. It was evidence-based design, and so the patient has their area. They have a waiting room seat for someone that will be coming with them, maybe, and they have area for to put things, as well as the nursing area that would their specific technologically pieces that they need from a technology standpoint, their sharps containers, their cleansing hands, gloves. So we do a lot of chemotherapy, we do transfusion therapy, we do hemotherapy, we do immunotherapy, which is the latest and greatest in all of the cancer therapies. So we have access to 4 of the immuno-oncologic drugs that we utilize here, and they're utilized in melanoma, breast, renal cell, as well as colon cancer.
Well, this has been John Bailey, and I've been with Dr. Una Hopkins, the Administrative Director of the White Plains Hospital Cancer Care Center. And I want to thank you for this great tour, and wish you best of luck, and congratulate you and President Susan Fox on this wonderful achievement for the county and the metropolitan area. Thank you.
You
have been heard.
Thank you very much.